Good morning and welcome back to my channel. Now I am discussing few of the questions frequently asked for the radiographers exam. So it will be helpful for all the radiographers who are preparing for the exam. So please do watch all the sessions and do support me. Dear friends, welcome back to the part 3 of Radiographers exam coaching. In part 1 and part 2, I have already discussed 20 questions. Today, I will be discussing the remaining questions. 21st question, Foramen magnum is part of option A or frontal bone, option B parietal bone, option C occipital bone and option D maxilla. The answer is option C occipital bone. The foramen magnum is a large oval opening foramen in the occipital bone of the skull in humans. Here you can see the foramen magnum. 22nd question. Common bone getting fractured in elderly people following a fall. Option A skull, option B spine, option C lower end of radius and option D neck of femur. The answer is option D neck of femur. Hip fractures are the most common fracture in adults over the age of 65. 23rd question. HST is the investigation of option A uterus and fallopian tube, option B biliary system, option C urinary system, option D small intestine. The answer is option A uterus and fallopian tubes. A hysterosalpingogram or HSG is an X-ray procedure used to see whether the fallopian tubes are patent, open and if the inside of the uterus, uterine cavity is normal. The usual indication for doing HSG is infertility. 24th question. The largest sesamoid bone in the body. Option A thallus, option B navicular, option C calcaneum and option D patella. The answer is option D patella. Sesamoid bone is a bone embedded within a tendon or a muscle. The kneecap or patella is the largest sesamoid bone in the body. 25th question. Largest muscle in human body. Option A gluteus minimus, option B bicep femoris, option C gluteus maximus and option D pectoralis major. The answer is option C gluteus maximus. The gluteus maximus is the largest muscle in the human body. It is large and powerful because it has a job of keeping the trunk of the body in an erect posture and it is the chief anti-gravity muscle that aids in walking up stairs. 26th question. The best radiographic view for Sella turcica. Option A AP view skull, option B cone lateral view skull, option C open mouth view and option D base of skull view. The answer is option B cone lateral view skull. The Sella turcica is a saddle-shaped depression in the body of the sphenoid bone of the human skull. The pituitary gland normally sits within the sella. 27th question. Xylogram is the investigation of option A, urinary bladder, option B, esophagus, option C, thyroid gland, and option D, salivary gland. The answer is option D, salivary gland. Xylography, also termed radioxylography, is the radiographic examination of the salivary glands. It usually involves the injection of a small amount of contrast medium into the salivary duct of a single gland, followed by routine X-ray projections. The resulting image is called a xylogram. 28th question. The common element used as intravascular contrast agent. Option A, calcium. Option B, iodine. Option C, gadolinium. Option D, carbon. The answer is option B, iodine. Iodine-based contrast medium iodine is having an atomic number of 53 and atomic weight of 127 is the only element that is proved satisfactory for general use as an intravascular contrast medium for radiography, including angiography and CT as well as special investigation procedures. 29th question. Tuberculosis commonly affects option A, bone, option B, brain, option C, lungs, and option D, intestine. The answer is option C, lungs. Tuberculosis, TB, is a disease caused by the germs that is spread from person to person through the air. TB usually affects the lung, but it may also affect other parts of the body such as the brain, kidney or the spine. But TB usually affects, or the main organ it affects, is the lungs. 30th question. Bile is secreted by option A, duodenum, option B, stomach, option C, pancreas, and option D, liver. The answer is option D, liver. Bile is a fluid that is made and released by the liver and stored in the gallbladder. Bile helps with digestion. It breaks down fat into fatty acid, which can be taken into the body by the digestive tract. 31st question. Elastography is new technique in option A, CT scan, option B, MRI, option C, ultrasound, and option D, DSA. The answer is option C, ultrasound. Ultrasound elastography, also known as the fibroscan, the test uses the sound waves to measure the stiffness of liver tissue. Stiffness is a sign of fibrosis. Nowadays, MRI elastography is also done. 32th question. High resolution CT, HRCT, is most useful in option A, lung diseases, option B, cardiac diseases, option C, brain, Option D, angiography. The answer is option A, lung diseases. High resolution computer tomography or HRCT is a type of computer tomography with the use of a thin section CT images of the order of 0.25 to 2 mm slice thickness with a high spatial frequency reconstruction algorithm to detect the diseases affecting the pulmonary parenchyma and airways. So in HRCT we are using a thin slices and it deals with the lung diseases. Thank you so much for your patient listening. Today I have discussed the remaining 12 questions frequently asked for the radiographers exam. Stay tuned for the next session, and the next session I will be discussing the remaining questions. Once again, thank you so much.